Dr. Sama Hirji. Today we're going to discuss about how we can look after our teeth. But before I give you the instructions, tips and tricks, now let's discuss how our tooth look like from inside, okay? So from outside, we can only see the enamels. But if we open our tooth and we see from inside, the tooth is composed of 3 layers. The outermost layer is called as enamel, the middle layer is called as dentine, and the innermost layer is called as pulp. So this is white color, this is yellow color, and this is red color. Okay? Now, the white color is a mineralized component. It is made up of hydroxyapatite crystals. Okay? It is very hard, tough. Okay? The inner layer, which is called as dentine, is a little bit soft, okay? It is made up of water tubules. So it makes the tooth more resilient, soft, and the innermost layer is the blood vessels. It is pulp, it has a nerves ending and the blood vessels. So here we get all the nourishment which go through to make the dentine vital and the tooth vital, okay? So what happens is that cavity can be happen on any surface of the tooth. From the top, which is the most common, called it class 1 cavity, from the top, occlusal surface. It could be from the side, okay? So there are 2 teeth. In between the 2 teeth, there could be a cavities, okay? The cavity could be near the gums line, okay, which is called as cervical cavities. So it on the occlusal surface, on the mesial or distal surface, or on the cervical surface of the tooth. So it could be in any side. Now if the cavity, if you see from the top, if the cavity happening from the top, there is a thick layer of enamel. It takes time before it reach up to the pulp. Okay, so you will not feel any sensitivity, but you can see a black spot. Okay, so if you diagnosed any black soft spot and a little bit of sensitivity, you should go to your dentist and get it filled, because there is a high possibility you can save this tooth with just a small filling. Okay, but if the cavity, it happened here, okay, in the mesial or distal surface or near the root surface, you can see there is a little no enamel in that area. Okay, the enamel surface is very thin. So as soon as the cavity happens, you will feel a lot of sensitivity and a lot of damage. So you will feel a lot of sensitivity, and it is very soft. And when you try to fill that, you are close to the pulp. Okay, so chances of filling become 50%. Okay, maybe your enamel is thin and you may have a severe pain even before you get the sensitivity. Okay, so you may end up in having root canal. Root canal is a procedure in which you remove whole pulp and make the tooth dead. Okay, it's like mummification. Yeah, so tooth is still remain in your mouth, but it's no more vital. So if you want to keep your tooth alive, it is important that you look after it. If you see any black spot or you have any sign of sensitivity, when you feel sensitivity with the cold, you have a sensitivity with hot, or you have a sensitivity with a sweet sensation, sweet after any ice cream or sweet, then it's an alarming sign that you have to visit your dentist, get your x-ray done, and treat it immediately so that the cavity not progress till the layer of the dentine and the pulp. Okay, if the cavity is progressed from enamel to the dentine, we can save it. But if it progressed till the level of the pulp, unfortunately, we have to do the root canal treatment, which is highly invasive and it's a long procedure. It's painful, it's a long procedure. You end up having a dead tooth in your body. Okay, so be careful. Prevention is better than cure. Prevention is always cheaper than cure. Good day.